Well, luckily, in our experience with providers, they overwhelmingly want this new technology. We've got no pushback at all. I think it's a lot like any other tool. They want the tool to work and be reliable, but they don't really care what's inside of it. You know, MRI machines have a lot of AI inside of them. Nobody cares. They just care that it gives you a good image. And I think that's what's happening here. When you talk about having an AI agent that can triage your inbox, they just go, thank goodness. You know, because I'd love to have an RN do it, but I just can't afford to hire an RN to dedicate to triage my inbox. So if AI can do it and it can do it faster and better, a pretty cool solution. Labs coming in on a Sunday, our AI agent will triage them and will send the patient a note. Hey, congratulations, your labs are normal Sunday morning. And the patient's going, wow, this doctor's working on Sunday. You know, so the patients love it because they're getting quicker response. The doctors love it because that's what they would have done anyway. They would have looked at it and said, hey, your labs are normal. Congratulations. So now the patient's relieved and they don't have to wait a week to get some providers, very short note like, okay, your labs are normal. You know, they don't typically spend a lot of time on those. So patients love it, providers love it, and we've seen nothing but just overwhelming adoption. And I think that's going to be the key here is providers just want help. They don't really care, is it AI, is it not AI? They just want something that works.